You take your socks off at the end of the day, and there they are, deep red grooves pressed into your skin right where the elastic used to sit. You press a finger into your ankle, and it leaves a little dent that takes a few seconds to bounce back. And somewhere in the back of your mind, a thought shows up that you can't quite shake. Is this my heart? I want to be honest with you before we go any further, because that thought deserves a straight answer, not a scare tactic. Sometimes, yes, swelling like this can be connected to the heart. I'm not going to pretend that possibility doesn't exist, because pretending would be irresponsible, and if I told you that, and you believed me and skipped a real symptom, that's on me. But here's what the research actually shows, and what I did not expect when I started digging into this. In most older adults, ankle swelling that comes and goes with the day, worse by evening, better by morning, is not primarily a heart problem. According to Mayo Clinic, this kind of fluid buildup, called peripheral edema, has several possible causes, and while congestive heart failure is one of them, so are weakened leg vein valves, venous insufficiency, medication side effects, and problems with the lymphatic system, the network that's supposed to be quietly draining excess fluid out of your tissue every single day. So today, I want to walk you through three things. First, how to actually tell the difference between probably nothing urgent swelling and call your doctor today swelling, because that distinction matters more than any home remedy. Second, what's really going on in your legs after 60 that makes this so common. And third, a 5-minute habit backed by real research on how your calf muscles and your lymphatic system work together that may help. I'm going to be careful with that word may, and I'll explain why as we go. Stick around, because partway through, I'm going to ask you to do something with me right there in your chair that tells you a lot about what's actually happening in your own legs. Let's get into it. Here's why swollen ankles feel so alarming once you're past 60. You've probably heard somewhere along the way that leg swelling can be a sign of heart failure. That's true, it can be. So the moment you notice it, your brain jumps to the worst case scenario, because that's what brains do with health information. They remember the scary version and forget the nuance. But according to Mayo Clinic's patient information on leg swelling, edema is described as a common sign of fluid buildup that might happen from standing or sitting too long, or it might be a sign of a more serious condition. Both of those things are true at the same time, and the job isn't to guess, it's to know which signs point which way. Let's talk about what's actually going on in your body, because understanding the plumbing helps a lot of this make sense. Your circulatory system doesn't work quite the same way at 65 as it did at 25. Every time you take a step, your calf muscles squeeze the deep veins in your lower leg, pushing blood back up toward your heart, working against gravity with every contraction. This is sometimes called the calf muscle pump, and it's doing a huge amount of quiet, unglamorous work every day of your life. Alongside that vein system runs a second network, your lymphatic system. Its job is to collect the fluid, proteins, and waste that leak out of your smallest blood vessels and are not immediately reabsorbed and carry it back into your bloodstream. It doesn't have a central pump like your heart. Instead, according to information summarized in resources like the Cleveland Clinic's Overview of Lymphatic Drainage, it relies heavily on the same thing your veins rely on: muscle movement, especially in your legs, to keep the fluid moving upward. Now here's the part that matters for people over 60. As we age, several things tend to happen at once. We move less throughout the day, our vein valves, the one-way doors that keep blood from sliding backward, can weaken or become damaged over the decades, and our lymphatic vessels, like most tissue in the body, can become somewhat less efficient. None of that is universal or inevitable, but it's common enough that Mayo Clinic and multiple medical sources describe leg swelling as relatively common in older adults and usually, though not always, not an emergency on its own. So when your ankles puff up after a day of sitting in the garden or standing in the kitchen, what's often happening is some mix of gravity pulling fluid down into the lowest point of your body, a calf pump that isn't being activated because you haven't moved much, and vein valves that aren't pushing blood back up as efficiently as they used to. The lymphatic system, already working on the margins, gets overwhelmed trying to clear the backlog. That's a very different picture than your heart is failing, and it's an important one to understand because it changes what you should actually do about it. I promised you I wouldn't play games with this, so let's go through the signs doctors actually use to sort out what's driving ankle swelling. I'm not a doctor, and none of this is a diagnosis. Think of this as knowing what questions to bring to your appointment, not a substitute for it. Signs that lean toward vein or lymphatic causes rather than the heart. Swelling that's mild in the morning and noticeably worse by evening, especially after a day of standing or sitting. Swelling that improves, even if it doesn't disappear, after a night of sleep with your legs roughly level, or after you prop your feet up for a while. According to a Q&A published by Mayo Clinic News Network, mild leg swelling in both legs without other symptoms is relatively common in older adults and is usually not serious, though it's still worth discussing with your healthcare provider because the underlying cause can occasionally point to something that needs treatment. You might also notice a heavy, achy feeling in your legs, visible varicose veins, or over time, some skin discoloration around the ankles. That combination is consistent with what's called chronic venous insufficiency, where the vein valves aren't doing their job and blood pools lower in the leg than it should. Signs that should move you toward call your doctor and soon. According to Mayo Clinic's overview of edema, you should see a healthcare professional right away if leg swelling comes along with shortness of breath, an irregular heartbeat, or chest pain. These can be signs of fluid building up in the lungs, which is a genuinely urgent situation. Multiple sources, including hospital vascular health resources, describe shortness of breath, particularly when lying flat, and unusual fatigue as symptoms more associated with heart-related swelling than with vein or lymphatic swelling alone. There's also a very specific pattern worth knowing: sudden swelling in just one leg, especially with pain or warmth in the calf. Mayo Clinic is direct about this one. After sitting for a long time, like on a long flight or really at any time, sudden one-sided leg pain and swelling that doesn't go away could point to a blood clot deep in the vein, known as deep vein thrombosis, and that needs medical attention right away, not a home routine. So here's the short version, and I want you to actually hear this part. Swelling in both legs. That's worse at the end of the day and better after elevation or rest, without shortness of breath, chest pain, or sudden one-sided onset. That's the pattern most consistent with the everyday, common vein and lymph-related swelling we're talking about today. Anything outside that pattern is a reason to get checked, not a reason to try a home routine first. And honestly, even the common pattern deserves a conversation with your doctor at some point, especially the first time you notice it, because plenty of things can look similar from the outside. Kidney function, liver function, thyroid issues, and certain medications can all produce a very similar-looking swollen ankle, and a doctor can actually check which one you're dealing with. Mayo Clinic's own list of edema causes includes kidney disease, liver problems, and certain blood pressure medications, anti-inflammatory drugs, steroids, and even some diabetes medications as possible contributors. This is genuinely not something to self-diagnose your way through. It's something to get information about so your conversation with your doctor is more useful, not less necessary. I want to correct something before I go further, because I promised you accuracy over drama. The title of this video says it's your lymph, and your lymphatic system absolutely plays a role, since it's the system responsible for clearing excess fluid out of your tissue. But if I'm being fully straight with you, the research doesn't support saying lymphatic problems are the single cause of typical after 60 ankle swelling. According to Mayo Clinic, true lymphatic system damage, a condition called lymphedema, is a specific and less common cause, most often linked to something disrupting the lymph nodes directly, such as surgery involving lymph node removal, commonly after cancer treatment. What's much more common in aging adults, according to multiple medical sources including hospital and vascular health resources, is chronic venous insufficiency. Those weakened vein valves I mentioned earlier. I looked for a solid number on exactly how common it is, and I want to be honest with you. The sources I found didn't agree with each other. One source put general chronic venous insufficiency at around 1 in 20 adults, becoming more common after age 50. Another described it as responsible for the large majority of swelling cases, specifically in seniors. Those numbers don't match closely enough for me to hand you one as settled fact, so instead of picking whichever sounds more dramatic, I'll just say plainly, the evidence agrees it's common and increases with age, but the exact share of cases is not something I can verify precisely, so take any specific percentage you see elsewhere with a grain of salt. Here's the more useful way to think about it. Your veins and your lymphatic vessels are working the same territory, using largely the same tool, the muscle pump in your calf, to move fluid back up your leg against gravity. When you sit still for hours, both systems slow down together. When your calf muscles are weak or underused, both systems lose their main source of help. That overlap is exactly why a habit built around activating your calf pump can plausibly support both systems at once, rather than one to the exclusion of the other. So a more accurate title might have been, "It's mostly your veins, with your lymphatic system struggling to keep up." Just slightly less catchy. What matters is that the mechanism I'm about to show you targets the actual physiology involved, not a myth. Before we get to the 5-minute habit itself, I want you to do something with me, because it'll make the rest of this a lot more concrete. If you're sitting down right now, look at your ankle and press one finger firmly into the skin just above the bone on the inner side for about 5 seconds. Then let go and watch what happens. If the skin springs back almost immediately, that's a good sign. Not diagnostic on its own, but reassuring. If it leaves a visible dent that takes several seconds to smooth back out, that's what's called pitting edema, and it's worth mentioning to your doctor at your next visit, even if nothing else feels wrong. Mayo Clinic lists this pitting, skin that holds a dimple after being pressed for a few seconds, as one of the recognized symptoms of edema worth getting checked. Now drop a comment and tell me, which ankle is worse, left or right, or are they about even, I ask, because that detail actually matters medically. Swelling that's clearly worse on one side, especially if it came on suddenly, points towards something localized, like a vein problem or possibly a clot, rather than a whole body fluid issue. Swelling that's roughly equal on both sides tends to point toward the more general, common pattern we've been talking about. I'm not going to diagnose anyone in the comments, but I promise you, just noticing that difference and mentioning it to your doctor makes you a much more useful patient in that conversation. Okay, let's get into the habit itself. I want to set your expectations accurately here because I'd rather underpromise than have you feel misled. This is not a cure. It is not a substitute for compression stockings, medication your doctor has prescribed, or treatment of whatever underlying condition is contributing to your swelling. What it is, a simple, low-risk way to actively engage the calf muscle pump, the mechanism your body already relies on to move fluid back up your legs, instead of leaving it idle for hours at a time. Where the evidence stands, a randomized trial looking at structured exercise for chronic venous insufficiency, published in the Journal of Vascular Surgery, found that exercise programs improved calf muscle pump function and helped with limb swelling in patients with vein disease. Though I want to flag that trial focused on more advanced venous disease with skin changes, and it used supervised, structured exercise over time, not a single 5-minute daily routine. Separately, ankle pump exercises are well established in hospital settings for a related but different purpose. preventing blood clots after surgery because the calf contraction genuinely does push blood, and by extension, that shared fluid highway back toward the heart. That mechanical principle, muscle contraction moves fluid upward, is well supported. What's less rigorously proven is exactly how much a short daily home routine done by a generally healthy older adult without a vein specialist supervising it will reduce everyday ankle puffiness. I'd call that a reasonable low-risk thing to try, not a guaranteed fix, and definitely not a replacement for medical evaluation of the underlying cause. With that honestly laid out, here's the routine. You can do this seated in a sturdy chair, which makes it accessible even if standing balance is a concern. Always check with your doctor first if you have any balance issues, a recent injury, a blood clot history, or a diagnosed heart or vein condition, since they may want to adjust this for you specifically. Step 1. Ankle pumps, about 1 minute. Sit with your feet flat on the floor. Lift your heels while keeping your toes down, then lower them, then lift your toes while keeping your heels down. Alternate this smoothly, like you're pressing a gas pedal and then flexing back. This directly contracts your calf muscles, which is the pump mechanism we've been talking about the whole video. Step 2, ankle circles, about 1 minute. Lift one foot slightly off the floor and draw slow, full circles with your ankle. 10 in one direction, 10 in the other, then switch feet. This moves the joint through its full range and continues engaging the lower leg muscles from a slightly different angle. Step 3. Seated marching or heel raises, about 2 minutes. If you're comfortable, march in place while seated, lifting your knees a few inches, or stand briefly holding onto a counter or sturdy chair back and rise up onto your toes, then lower slowly for a set of 10 to 15. This is the most active calf contraction in the routine, and it's the closest to the kind of movement shown in that vascular surgery trial to support calf pump function over time. Step 4. Gentle upward stroking, about 1 minute, optional, with clean, dry hands, using very light pressure, lighter than you'd think. This isn't a deep massage. Stroke from your ankle upward toward your knee, and from your knee upward toward your thigh, in the direction fluid is meant to travel back toward your heart. This borrows a principle from manual lymphatic drainage, a specialized massage technique. I want to be fully transparent with you here. The research on manual lymphatic drainage is genuinely mixed. It has real documented use for lymphedema after cancer surgery, and one clinical review found a positive effect during the maintenance phase of that specific condition. But other reviews, including a meta-analysis looking at recovery after knee surgery, found the evidence inconclusive, and UCLA Health has published commentary noting that many popular claims about lymphatic massage lack substantial scientific support. So think of this fourth step as a gentle, low-risk addition that borrows a reasonable principle, moving fluid in the direction it's supposed to travel, rather than a proven treatment on its own. Step 5. Elevate, if you can, for the last minute or two. If you're able to, put your feet up on a stool or ottoman, ideally above the level of your heart, for the last stretch of your 5 minutes. Elevation is one of the most consistently recommended, evidence-supported pieces of standard care for everyday leg swelling, right alongside compression and salt reduction, according to Mayo Clinic's own treatment guidance for edema. That's it. 5 minutes, done seated or with minimal standing, once or ideally twice a day. Morning and evening tend to bookend the hours of sitting well, though there's no rigorously established best frequency for a routine exactly like this. So I'd rather tell you that honestly than invent a number that sounds more official than it is. The 5-minute habit isn't operating alone. It works best alongside a few other things that have stronger, more direct backing. Compression stockings. Mayo Clinic lists wearing compression garments as one of the primary ways to relieve edema, and a systematic review of studies in older adults, with chronic venous insufficiency found that certain classes of compression stockings reduce the recurrence of leg ulcers compared to lower strength options. But, and this is genuinely important, not a throwaway caveat, compression stockings are not automatically safe for everyone. Multiple studies agree that in people with significant peripheral artery disease, meaning narrowed arteries rather than weakened veins, compression can reduce blood flow to the leg and cause harm. This is exactly the kind of thing your doctor can check quickly, often just by measuring blood pressure at your ankle compared to your arm, before recommending a compression strength that's right for you. Please don't just buy the tightest pair you can find. Get guidance first, especially if you have any known circulation issues in your arteries, not just your veins. Reducing salt intake. Mayo Clinic lists eating too much salty food among the causes of mild edema, since sodium encourages your body to hold on to fluid. This doesn't mean chasing zero sodium, which brings its own problems. It means being mindful, particularly around processed and restaurant food, which tends to carry far more salt than home cooking. Movement throughout the day, not just 5 minutes of it. The whole reason swelling builds up is often simply hours of stillness. If you have a job or a habit that involves long stretches of sitting or standing, breaking that up every hour or so, even just standing and shifting your weight or doing a quick set of ankle pumps at your desk reduces the amount of time fluid has to pool before you address it. Staying appropriately hydrated. This one surprises people. When you're dehydrated, your body can actually hold onto fluid more aggressively as a protective response, so drinking enough water within whatever limits your doctor has set for you, this matters especially if you're on a fluid restriction for a heart or kidney condition, supports normal fluid balance rather than working against it. And the one that matters most, an honest conversation with your doctor about medications. Mayo Clinic specifically lists several medication categories connected to edema, including certain blood pressure medications. Calcium channel blockers are frequently mentioned, anti-inflammatory drugs, steroids, some diabetes medications, and even certain nerve pain medications. If your swelling started or worsened around the time you began a new prescription, that's worth mentioning by name at your next appointment. Please don't stop any medication on your own based on this video. That decision needs to be made with whoever prescribed it, since the medication may be treating something more serious than the swelling it's causing as a side effect. Let's zoom back out. If you take one thing from this video, I'd want it to be this. Swollen ankles after 60 are common enough that they don't automatically mean something is seriously wrong. And the research consistently points to weakened leg veins, everyday fluid dynamics, and a lymphatic system that's simply overwhelmed by inactivity as the most frequent, least dramatic explanations. That's genuinely good news, and it's not me softening the truth to make you feel better. It's what the evidence actually shows. At the same time, usually not the heart is not the same as never the heart, and it's not the same as never anything. Shortness of breath, chest pain, an irregular heartbeat, or sudden one-sided swelling with calf pain are not things to wait out with a home routine. Those get a phone call to your doctor, ideally the same day. Everything else, the everyday, both legs, worse by evening, better after rest kind of swelling, is worth mentioning at your next regular appointment and worth pairing with the small, low-risk habit I walked you through today. A few minutes of calf activation, gentle upward movement and elevation, alongside the basics of salt awareness, appropriate hydration, and a real conversation about whether any of your current medications might be contributing. I'm not a doctor, and I'm not going to pretend a 5-minute chair routine replaces whatever conversation you need to have with the person who actually knows your health history. What I can tell you is that the mechanism behind this habit, using your calf muscles to help move fluid your veins and lymphatic system are struggling to move on their own, is grounded in how your body actually works, not in fear or hype. If this helped you understand what's actually going on in your own legs a little better, that was the whole point. Try the routine for a couple of weeks, keep an eye on how your ankles feel by evening, and bring what you notice, including anything from that little press test we did earlier, to your next doctor's visit. That's genuinely one of the most useful things you can walk in with. Take care of yourself, move a little more than you did yesterday, and I'll see you in the next one.